presenting on the topic, a survey on the use of anti-typhoid drugs in patients diagnosed with typhoid fever. And the work was supervised by Dr. Kweku Apiakumi. Now this is the outline of the presentation. Now the introduction, typhoid fever is a disease that is caused by the bacteria Salmonella cerevisiae. And this disease can be contracted through food or water that are being infested with or contaminated with carrier people who has this type of fever. And signs and symptoms of this disease are primarily the primary one is high temperature. Then we have the headache, we have irregular bowel movement, and then we also have nausea as some of the symptoms. Now this disease has become a significant public health concern that needs to be addressed. Now, though occurrence of this type of fever were widespread, but with time it has been reduced due to the improvement of the availability of water and the sewage management system. The antibiotics have now helped so many lives. Though the time there were no antibiotics, a lot of people died out of this disease. But with the help of antibiotics, it has reduced the rate of this type of fever. Now, with understanding understanding how patients who are diagnosed with typhoid fever in the Bronco here, it will help us know how public health intervention will be kept in the Bronco here. So we look at the problem that prompted us to look at this topic was a publication that was published by World Health Organization in 2016, which estimated the cases of typhoid fever to be 17 million cases. Now, researchers also estimated in a review, systematic review, in 2017 to have been 14.3 million. Then this illness is very common, mostly in low-income areas, where these diseases are more prevalent. Low-income areas like Africa and Asian, as well as Nabrongo, which is located in Africa here. Now, that's why the alarming cases of the typhoid fever. Now, there have been lack of clear data on the antibiotic use, self-medication, practices or challenges people face in the Bronco here, available on the agendas for people to see. Now, with the justification, we realize that antimicrobial resistance has become a global issue now, which some of these are the factors that are resulting in that antibiotics. We have self-medication, we have insufficient administration of drugs, we have excessive prescription of antibiotics, and we have overuse of antibiotics. These are factors that will lead to the resistance of these antimicrobials. Now, typhoid management can be compromised due to improper usage of drugs, incomplete treatment process, and poor access to healthcare facilities or services. Now, with my objectives, I'm looking at to determine the use of anti-typhoid drugs in Nabrongo or in people who are diagnosed with typhoid fever in Nabrongo here. Then the specific objective is just to assess the understanding of typhoid fever to assess the level of understanding of people who have been diagnosed with typhoid fever in Nabrongo here. Another one is to determine the type of anti-typhoid drug that is commonly prescribed in Nabrongo here. Now, we also try to look at the prevalence of self-medication in Nabrongo here, and also to determine specific challenges that patients face in assessing and utilizing anti-typhoid drugs in Nabrongo here. And also to identify factors influencing their choices. Now, with the methodology, study design we used was a descriptive cross-sectional survey. We recruited 15 people in Adongo here who have been tested positive. Then the questionnaire were issued to them. The questionnaire were kept in categories, which were trying to look at their awareness towards this type of fever and how they use the drugs, how they often self-medicate, and also to assess some of the challenges they face. And the data collection procedure was done based on the questionnaires. So we visited hospitals, people who were visiting or coming to the hospital in the week they were being tested positive. We administered the questionnaires to them to help get the data, and we also went to marketplaces and did conduct interview to see people who have been tested positive, to also get some information from them. We also entered into the residents of the Dongo radio homes to interview people, and our priority was always on people who have been diagnosed positive. It wasn't everybody. So we also recruited some of the students that have been diagnosed positive in Dongo here. Now, after conducting the survey, the quantitative data from the questionnaire were now analyzed using the SPSS, which is the Statistical Package for Social Sciences. Then the descriptive data were presented in the form of tables with their frequencies and then percentages indicated. Now, with the results have been summarized in table forms. Now, and they are being kept according to the categories in which the questionnaires were issued. Now, one of them, which are looking for the demographic information, realize that when with that one, the 18 to 38-year group were having this more. Then the table 2 also shows that when we try looking at the occupation, it was recorded to have been students who has more type of fever. Then with the sex, female were having the life percentage. And then when we look at the people who also, the education aspect, tertiary people who have made it to the tertiary level were also recorded high. Then to know how many people know that at least all those who repeated responded yes, they knew type of fever. And then to trying to see if they understood type of the causes of type of fever, a significant number of 54 actually gave type of fever as the main cause, even though some few people relate the cause to the source of the infection. Now, the other thing is the prescription and the use of antityphoid drugs, which we were trying to assess the people to see if this type of fever can be cured. Then we realized that from the responses, 98% said no, it can be cured. Then with that, people, even though they said it can be cured, we still try to look at if the disease can be eradicated completely from the community. And realize that 72% of the people said, oh, the disease can be completely eradicated from the community, even though 28 people didn't support it. Now, when we try to ask, after they say they've been tested positive for the typhoid fever, we're trying to see if they really know anti-typhoid drug. And 82% of the people said yes, they knew what anti-typhoid drug was. And when we also went to know if they used typhoid fever drugs in this 2024, and 64% also say yes, they actually used 64 typhoid drugs in 2024, even though some were yet to take. They have just gotten the drugs, but they have not yet taken. So as a result, if we further ask, they will be able to give more insight on that. And then when we still we're now looking at the drug you receive. What were the specific drugs you were given? Now, rather than ciprofloxacin was the commonly drugs used here, and azithromycin and other medicines were also used, even though some people actually could not also mention out the drugs they were given what they have forgotten. Now, the factors that influence most of these people's choices in assessing these drugs were doctors' recommendation with the highest dosage, and others which could be which are also the availability of drugs and so forth. Now, when we look looked at how many people self-medicated, it was realized that about 18 people of the respondents responded yes to that they have actually self-medicated. Now the reason why they self-medicated was some said, oh, health practice for them, others said because of high cost of hospital bill, others said no money at that time. And some too, they realized was available at market and they just bought. Now, when we now have tried to assess how many times they self-medicated, the 82 people who in the business said they did not self-medicated, is in wholesale. Then with the one, at least 11 people said they self-medicated once in this year 2024, and at least 7% said they self-medicated twice in this year 2024. Now we're further looking at if they had taken their drugs at health facilities, then 80% said they actually obtained or got their drugs from healthcare facilities, while 20 people did not. Then we further try to see if they had taken these drugs, if they tried to visit the hospital for this, they conducted a lab to confirm the presence of this thing before, and 70% said, oh, anytime they went for them, they conduct tests before giving them the drugs. 22% also said, oh, for one time I went, there wasn't any test to confirm that I was giving. Then 8% also said, oh, they have done that twice without conducting tests to me before giving the drugs. Now when we now try to assess, after they have been given the drugs, whether they were adhering to the drugs or this is. So when we look at the number of times they took the antityphoid drug, we realize that 50% said, oh, they took the drugs once in a year. Then 22% did not actually take the drugs back from the hospital or well-recognized drugs, but it could be these people could represent the self-medicated people or people who got their drugs from either the herbalists or in the market square. So we also have 8% said they got they took the antidote drug 3 times. Now when we try looking at how they get the drugs, about 49% took their drugs from hospitals and the others. Now we were trying to see if they completed the medication. 71% actually say yes. The drugs given to them have been completed, while 16% said no, they could not complete the drugs. Then 30% sometimes complete the medication based on some reasons, which we will see soon. And the reasons are, some actually forget to complete the drugs when they get well. Some say, oh, they were feeling headache, that's why they couldn't complete it. And then some people, they just got well and they stopped.
You have 2 minutes more.
So, when we went to look at the discussing, it was realized that the year group with the high disease was the 18 to 45 year group, which was supported by a study conducted by this CBC. We also realized that it was also realized that 70% of the participants had formal education and they completed tertiary education as well. Now, when we tried looking at the relationship between, we realized that because those people were well educated, they could recognize the significance and the importance of following recommended treatment. And was also that female was recorded higher percentage. And the study was supported by this APWA 2021 in Douala at Cameroon. Then when we tried looking at the awareness about this disease, 100% was fully aware of the disease. And it was also realized that the people who got the sources where people get these diseases were actually from where the 100% people recognize the disease and its cause. The study was also supported by this person in 2021 that so actually food and contaminated water was also realized in Ethiopia as some of the causes conducted by students. So when we started looking at the knowledge, even though they were very
29 seconds.
response to know if typhoid fever can actually be eradicated, we realized that 54% said yes, this can be eradicated, while the other few people relate do not also accept that the thing can be eradicated. So now, in conclusion, this study determining the use of antiviral regardless of the awareness of the diseases, issues such as self-medication, incomplete prescribed medication, and drug resistance, still persist in the Bronco, still persist in tactical management. There are some economic factors like availability and cost. This can also impact the treatment outcome. Now, some individually barely completed their prescribed medication based on certain factors, which could result in ineffectiveness of the treatment or contribute to drug resistance. Now, while typhoid fever awareness is high, there are still some practical treatment and several issues that need to be attended to in order to have an improved public health outcome. Recommendation: I recommend community-led sanitation program and behavioral changes campaign. I also recommend strengthening of health education, which emphasizes on the importance of completely prescribed medication causes and the risks associated with self-medication. I also recommend that financial barriers to accessing healthcare should be addressed through government or community initiatives that subsidize the cost of consultation and medication, particularly in low-income households. These are my references. Thank you.